Hi guys, me again. Just another quick instalment. As you can see from the title on this post, it's about low back pain. The reason why I decided to post this one up for you guys is because I've had a lot of questions from patients and clients that I've treated over the number of years now. Time's going really quickly for low back pain. And I've had a recent inquiry. Someone was saying to me that they've spent years with physios, GPs, osteopaths, chiropractors, various other professionals and therapists to try and get to the bottom of the cause of the low back pain. And that got me to thinking, here's a good article. So, cause of low back pain. Here's an answer for you immediately straight away. If you're suffering from a bad back, a bad lower back, or you ever have done, so that's going to apply to about 90% of you lot that are watching this video and hopefully reading this post as well. There's a simple answer for you. Don't look for the cause of your low back pain. Don't worry about finding the cause of your low back pain because there most likely isn't no specific cause unless you have a degenerative disease such as osteoarthritis or rheumatoid arthritis, osteoporosis and various other conditions as well. There is no real cause or one real cause for low back pain. It is a fruitless way to spend your time. And if you're with other specialists and you've worked with other specialists, that have been claiming to try and help you with your low back pain, and one of the things that everybody's trying to get down to is some form of diagnosis. If you've been, or it's not necessarily diagnosis, but looking for a cause, especially if you've been diagnosed with what we call non-specific mechanical low back pain, then you change your specialist and change the person you're working with because it really is a waste of time. If you want to treat that low back pain, and this is not an advert, by the way, to say, oh, come down and come see me. The best way to treat that low back pain is to move and is to use it. And to move and to use it in the correct way. Now, you've probably heard that before as well. Yes, there is a science behind it, of course there is, and I could sit here and list off all the individual lower back muscles, core muscles, and muscles around that particular area, which gets me onto my next point. With that movement and that exercise, you do need to make sure that what you're doing is quite functional and very relevant to you and your specific issue. So the low back pain could have a number of issues. Like I said, it's fruitless looking for one specific cause and one specific life event that's caused it. But it could have a number of issues that are related to muscular imbalances and various issues with your posture. So it's a number of things. It's one big puzzle. And that's the investigation. It's a bit like a detective work that I do with my clients. I'll do a various battery and barrage of assessments, look at their posture, how they move and so on and so forth. But at the end of the day, it all leads into one main goal. I analyse and look at how my client moves. I find out their life habits, their occupation and so on and so forth. I find out what movements irritate it, what doesn't, what we call their overcompensations and their coping behaviours as well. I put all of that together. And the idea of my treatment is to correct those imbalances, correct those incorrect movement patterns and so on and so forth, and also work with them from a psychological basis, from a pain management perspective. So no matter how good the training that it is that I do with you, can I say to you, you're never going to get low back pain ever again? Of course I can't. You will get occurrences, it's just we can greatly reduce the likelihood of that occurring again. So it's also, when I say the psychological bit, it's about the psychological management of that low back pain. So how you deal with it, how you manage it, if or when it occurs again. So that's how we manage low back pain. And getting back to the science of it, if there are various muscular imbalances and everything that I've identified, my training is aimed at dealing with that and getting you to move better. So in a way, what I'm saying is this lower back rehab and strength and conditioning and strength training, mobilisation, a bit of flexibility, all these components of training, they all go hand in hand. So if you are looking for any advice or anything like that, again, it's not an advert. If you're looking for any advice and you've been suffering with low back pain, hit me a message up on this Facebook page, message me personally, and I'll give you some advice and I'll give you a hand.